Good morning, everybody. Welcome to Leadership During Crisis Session number 7, Fit for Duty, Returning to Work After COVID-19. Well, I'd like to say it's really after COVID-19. COVID-19 is still going on. However, everybody's starting to return to work now, and I think the country is kind of cheering that on. So I'm excited about it. I know that. So let's go to the next slide so I can introduce our guest. All right. I am Jay Womack. I'm the CEO of Infinity Workforce Solutions. I appreciate everybody taking time out of their schedule to be here today. We are very excited about what we're about to present. Mark Ray is hosting with me. Mark is down in the valley and he's working off of a cell phone today, so we may see Mark come and go off the cell signal down there, but really pleased to have Dr. Shirley with us. But Mark, why don't you take over since you worked with Dr. Shirley and know him extremely well. Tell us everything you know about this guru on how we return to work safely.
Well, thank you for that, Jay. Yes. Good morning, everyone. My name is Mark Ray. I'm down here in the Rio Grande Valley today. And if you haven't put Rio Grande Valley cantaloupe on your menu for Veterans Day weekend, I would recommend you do that. It's really going good down here. So today we have a nationally recognized expert in the field of fit for duty, Dr. Jeff Shirley. I've worked with him very directly. He and I knew whenever he came into my office and said, Mark, we need to talk, I needed to pay attention, but he is totally focused on this very important issue of fit for duty. He's also going to brief us on the waiver, the FMCSA waiver, and some of the things we need to take into consideration during this interim period on the waiver. Also, a return to work for your non-driving staff. So we got a lot to cover. And before I get too far, I just wanted to start off with a quick question. If you can go to the next slide, please. Or Dr. Shirley, you want to introduce yourself? How did I do there?
Oh, you did pretty good. I've known Mark for many, many years now, and it's a gracious introduction. I appreciate that so much, and look forward to helping people out today and getting some information about the Fit for Duty and what's happening in the COVID crisis and see what we can do to get this thing working the right way.
Excellent, thank you. And just as a comment, in the lawsuit world, it's very comforting knowing that you have a solid DOT examiner behind you all the time. So next slide, if you would, please. Okay. Jay, you want to kind of keep us up to speed?
Yeah, I appreciate that. Since this is part of the leadership practices, and let's review those real quick for those of y'all that participated in the past. I'm going to remind you that when the crisis hit, we put together a very unique team of people. How do we address the crisis? And the first thing we wanted to look at was leadership practice number 1 was to propel the psychology of the problem solver, make sure that we maintain a positive attitude about everything. Number 2 is the new effective organization in crisis management. That's what we're going to be focused on today. That's why that's highlighted in red. Number 3, leadership practice was more agility. Number 4, leadership practice, the healthy rhythm of an organization. And then number 5 was empathy and bonding. And we're going to focus today on number 2. That's what Dr. Shirley is here for. So if you don't mind, let's go look at that organization on the next slide. So if y'all recall, the people that have been on board and the ones that have not, I'll go through this again, and I'll do it for the first time for the new people. This was the new organization that we set up. When problems occur, obviously you've got your old standard organization in place that knows how to run that company. But when things change, when you have so much uncertainty, like we have right now in the world around us, then the executive team's got to put together, for lack of a better term, a real leadership group so that they can handle the crisis. People that respond to the times, people that are quick to respond, they don't panic, they look at the situation and they address it immediately. And so the executive team has got to have several different situations. Number 1, they've got to map the situation. They got to maintain what's going on in the world around them. So obviously when it first started, we had all these different issues about trucks going down the road. Where are they going to stop? Where are they going to spend the night? Where are they going to use the restroom? Where are they going to eat? All of those types of things. Well, now we're starting to see a little bit different. Now we're starting to see people go back into the workforce. So it's not just the truck drivers, it's also the office workers. When are they going to come back? How's that schedule going to work? So they have to map the situation, and the situation has changed pretty rapidly in the last 8 weeks. I would like to say kind of down, and now trying to climb back up. They've got to look at the important scenarios. They've got to prioritize them. They've got to address them. They've got to drive change. They've got to communicate, which is where our system comes in. That's why we host these types of meetings. You can use our system to communicate with your team and then to reteach people and get out there and make sure that everybody's on the same page. The executive team needs several organizations. They need a response organization. And this is really where Dr. Shirley comes in. So we call it the SWAT team in that area. So those people are people that really care about the company. They want to respond rapidly. So the response organization is made up of medical advisory. And in the past, we've said you don't necessarily have to have a real doctor. You have to have someone on staff that absolutely understands research and knows how to research it and go find out what the best practices are from the CDC and from places like that. And then the response team, situation. What's the situation? And you have to have a rapid response. I mean, we've had several examples in the past on these webinars, and we've got these recorded on our website. You can go see the past ones. But different situations where a truck driver may pull up to a loading dock and there's no one there. What happens in this situation? Where do they go get food? So the response team quickly does all of that. So this is the rapid deployment team. Technology and learning, and we're seeing what we've seen in a boost in our industry is that remote training has become more and more important. So just-in-time education. How do you get your people trained? How do you orientate people? How do you still have to see some of them in person. You have to have some hands-on, but if you can keep people ahead of the game on orientation, things like that, with a system like ours, that's what you ought to do to keep people out of harm's way as much as possible. And then financial stress tests on companies and workers' comp and issues like that. So that's part of the SWAT team. Now, the peer team, and we're going to come back to Dr. Shirley on this in just a second, because that's what we're going to talk about today is the specialized knowledge of how do you go back into the workforce. But before I do that, let's talk about peer support teams. The truckers, they're out there on the road. They're seeing what's happening in the real world one-on-one. So they can share best practices. The dispatchers, they're listening to the truck drivers. They're listening to everybody in the company. They're having to communicate between the company, the clients, and the truck drivers out in the field. So very critical to find out what they're hearing. And then operations, how are things changing? What's going on in the world? So this organization, this structure that we put into place, we actually did in our own company after we put together a really unique group of people. And I don't want to say that we have thrived during this opportunity, but we have, or crisis, I guess you can call it an opportunity or a crisis. I want to say that we thrived during this, but we've definitely survived and we've continued to grow during this. And I think a lot of it is attributed to this type of a structure. So we had rapid response. We're a small company, so we can respond anyway, but it's been incredible. And bringing people on board like Dr. Shirley has been a major part of what we've done. So we listen to these guys, we listen to the experts, we pay attention to it, and we create an action plan, and then we execute on that action plan. So with that in mind, Mark, I think we need to go to the next slide and introduce Dr. Shirley to his subject matter that he is the expert on.
Yes, and just to kind of frame that, I know we are in an unusual time frame where the FMCSA has extended medical certifications, which means we have drivers out there with expired medicals. That's got some good points, and it might have some points that are challenging. So I would like to just ask, and I know there's prescriptions or lifestyles that eating habits that are thrown off. There are a multitude of issues. So Dr. Shirley, you want to just kind of tell us your comments on the extension of the medical certificate?
Yeah, thank you, Mark. The biggest thing that I noticed that this certification expiration came about March 24th, and I got an email, and I started reading it, and I'm like, oh my God, what is happening, to this type situation where now drivers are going to have a 90-day, we call it grace period, to have a medical examination. or to certify their driver's license through the DMV. And I was really concerned for the fact that in my experience of over 6 years and close to 15,000 exams, the biggest concern we already have, even before the crisis, was the ability of each of the drivers to monitor themselves, their medications, their rest, their sleep apnea, their diabetes, whatever medications they may have. I was really concerned because now the guys are going to say, hey, I don't have to have an exam till July. And if they're already not, focusing on their own health issues, then we have some issues that we need to deal with. The great thing about this type situation is the policy of each individual trucking company, executives, whatever it may be, they still are following their policies and requiring each of these drivers to have their certifications. And as you can see in the slide here, basically, I'll kind of bit through it a little bit. I won't read all of it, but the thing is the FMCSA, the MEC, which is called the Medical Examination Certificate Waiver, temporarily amends the requirement to have a current medical certificate until June 30th for interstate, CDL, CLP, and non-CDL drivers. They have to have proof of a valid medical examiner certificate that was issued for a period of 90 days or longer and expired on or before March 1st. The requirement also says they don't have to self-certify until that particular time. And the waiver also removes the requirement for the state driver's license certification, as I just said. Let me go to the next slide. And the next slide basically is here's some of to whom that the waiver does not apply to. The waiver does not apply to CDL or CLP holders if the driver's privileges have been suspended or withdrawn for traffic offenses. Drivers who cannot produce evidence of a prior medical certification that expired on or after March 1st. And thank God for the policy of the companies that I'm dealing with is they also need their long form also. If they don't have their long form, then this waiver does not apply to them. Also, new drivers who have never obtained a medical certification, drivers who have been diagnosed with a medical condition that would disqualify them from operating interstate commerce, or drivers who have developed a condition that requires exemption, skill performance evaluation, and FMCSA are not covered under this waiver. And the waiver does not apply to medical examiner certificates originally issued for less than 90 days. So it kind of gives you, if you look at it, 90 days is a quarter of all the drivers out there today. And I don't know how many drivers, 3-4 million drivers. So basically you're looking at maybe 1 million drivers that may have this type situation. So we want to be very concerned about their overall health, because I've noticed that some of the drivers who maybe take off for a couple weeks or a month for vacation or whatever, they always come back. When I do their examinations, I always find that they've gained 5 or 10 or 20 pounds. Their blood pressure's up, their diabetes is up, and it's something that we need to watch and concern ourselves with. But we're going to talk about, go ahead and go to the next slide for me. So basically, what does a certified medical examiner do? And this is a really general statement from the FMCSA 391.41. It says, the medical examiner shall be knowledgeable of the specific physical and mental demands associated with operating a commercial motor vehicle and the requirement of this subpart, including the medical advisory criteria prepared by the FMCSA guidelines to aid the medical examiner and make the qualification determination, and be proficient in the use of and use the medical protocols necessary to adequately perform the medical examination required by this section. We as certified medical examiners are required to take a training. The training course could take anywhere from 4 to 6 weeks, depending on the program they went through. And then we take a national test to pass the test to become a certified medical examiner. There are a lot of certified medical examiners who only do this part-time. I'd say probably the majority of them. So their technique and their protocols necessary to do the examination may be good, but sometimes they don't really look at the driver as a person, they look at it as a number. And sometimes they may bypass this. I say this because of the examinations I've received and I've seen to monitor or to check out for certain companies. I notice sometimes there's issues with that we're going to talk about with certain medications. You can go to the next slide for me, please. So the three main categories of physical qualifications that are concerned, not only for this particular pandemic type situation, but also for all times, of the three main things that I see. One of these is high blood pressure. There is new stipulation for blood pressure readings, but we're going to follow the old guideline, which the blood pressure must be below 140/90, either on medication or no medication at all for qualification of blood pressure. Diabetes type, actually, we're going to put type 2 instead of type 1, because I'm going to talk about type 1 also. The blood glucose at the time of the examination must be below 200 milligrams per deciliter and an A1C of below 9.0. A lot of times I'll get drivers that come in and say, well, I just had my examination last week and it was perfectly fine. They come in the next week and their blood sugar is just way out of control. And it's not that it was the examination, it was actually the driver not following his protocol, taking his medications like he should. That's something very important that we need to follow because they are at risk for a safety issue. And of course, sleep apnea. As I call these, this is the trifecta of medical issues. I look at these three more than anything else, along with different medications. But the current sleep compliance report is 70% usage at 4+ hours per day. And these are the three things that I look for in any type of driver when they're getting their new certification. And you go to the next slide for me.
Dr. Shirley?
Sure.
Dr. Shirley, I had a quick question on the sleep apnea.
Sure.
The sleep compliance report said that has not been waived during this interim period. They're still going to need to be able to provide the sleep compliance report after this waiver has expired. Is that correct?
That is correct. Of all the drivers I've had over the last 7 or 8 weeks, I've only had one driver to postpone his medical examination because he said he didn't need it till July. And so I made sure to know that this particular driver is going to be a little bit more, I'm going to be looking a little bit more in depth at his health records over the next 90 days, just to make sure, because it looks to me like he says, well, I just don't need to do it, so I won't do it. So he doesn't follow his health records. But yeah, when they come in, and at any time, whether it's now or by June 30th, they still have regulations that they had to follow, taking the medications, making sure their numbers are correct, following with their primary care physician, and making sure that they are in good health. As a certified medical examiner, these are not my patients. I don't treat them as patients. I treat them as fit for duty. And some of the medical examiners out there, they will go out and say, hey, this driver's medication is perfectly fine. And I'll question and say, well, they're not your patient. It's just a fit for duty. So, making sure that the medical examiner follows through their recommendations, but making sure that each and every one of these conditions is properly taken care of by their primary care physician is the most important part. You can actually the next slide for me, please. Perfect. So we talk about diabetes 1. This used to be a disqualifying program, but I think in 2018, they decided to bring diabetes type 1 insulin-dependent qualifications back. And I've actually had several drivers who are type 1 who've come into their Class A. And it's basically, it goes like this. It's the driver or the applicant has to have a primary care physician, a PCP, evaluate and fill out an insulin-treated diabetes mellitus assessment form, FMCSA 5870, which they can find on the FMCSA webpage. Once the information has been filled out and signed by the PCP, a medical exam may be performed by the certified medical examiner to determine if the driver is fit for duty, but the CME also has a final determination regarding the certification. Just because he gets things filled out by his medical doctor and get all the forms filled out, if the certified medical examiner, he has the final say-so, determining if he gets certification or not. Next slide for me. So one of the things that we also concern ourselves with as a certified medical examiner in which I've always tried to find out, and the FMCSA never gives you a direct answer, is what are the qualifying medications for certification? Well, there's not a list, except for your category 1 prohibited: heroin, marijuana, PCP, cocaine. All those type drugs are forbidden, of course, but there's not really a list of it. It really goes down to each individual medical examiner's qualifications and their ideas of what they see. The biggest thing that I noticed with a medication, other than blood pressure and diabetes, is medications involved with psychiatric type situations: depression, anxiety, insomnia, attention deficit disorder. Those medications are a little bit leery for me. Depression is an okay medication. It doesn't affect the central nervous system as much as an anxiety medication. The biggest thing is finding getting a medical release, which they have on the FMCSA form. If a driver comes in with any type of psychiatric medication, he has to have, in my opinion, he has to have a medical release from his primary care physician that says that he is able and safe to operate a CNV. Some of the medications that I see, which I've talked to other primary care physicians, is what is the half-life, or how long does the medication in the body, and are they safe to drive, like an anxiety medication. In most of those medications, there is a 12-hour half-life, meaning once they start taking the medication, they can't drive or do anything in a 12-hour period. Well, as a medical examiner, we can't qualify a driver if there's a limitation to his ability to drive the truck. That's one of the things we have to notate. And if someone, drives till 9 or 10 o'clock at night, and then they're required to get back up, of course they have their 10-hour wait for that time, but they don't wait that time, the medication is still in their system, so they could be a safety hazard for that type of situation. That's why I really have a hard time certifying anyone with any type of anxiety, attention deficit disorder, those insomnia medications. Usually I won't certify them for that. So next slide. So let's talk a little bit about the medical marijuana usage. As we know, around the United States, I think there's 38 states now that are legally have medical marijuana, and some states have recreational marijuana, that you can actually go to the doctor, get a prescription, get a medical marijuana card holding person, and take this medication for any conditions that the primary care physician recommends that they use the marijuana for. Unfortunately, this is still a federal category 1 drug that you cannot take and operate a CNV, as you can see. Can a driver meet the qualification standards under 49 CFR 391.41B12 if using medical marijuana recommended by a licensed medical practitioner in the United States or another country? The answer is no. Marijuana, including a mixture of preparation containing marijuana, continues to be classed as Schedule I controlled substance, and basically goes through there. So you cannot take that. Another question, which I don't have a slide for, but we'll talk about, is the CBD. And CBD is now legal in just about every state, if I'm not incorrect with that. But you got to be careful with CBD. There's 2 types of CBDs. Some of the CBDs do have the lowest limit of THC available that's legal for the state, and that can actually pop up in a drug screen or drug test. But they also have CBD products that do not have any THC at all. And it is the driver's responsibility to know which one does have the legal limits of THC and which ones that do not. Because I've had some of them ask me before, can I take CBD? And I'll say, if it has THC, well, they said it didn't have it. And I said, well, bring me the bottle and let's take a look at it. And come to find out there's a 0.3% THC in it. I said, you're going to pop out, being hot on your drug screen if you take this product. But they still can take it, but it cannot have any THC. or marijuana in the product. And THC is the part that causes the dizziness. Everyone knows what marijuana does to you.
Yeah, Dr. Stroud, a quick
I'm
question.
63. I do not.
But the CBD without the THC does not cause that the mind-altering type issues involved with marijuana taking.
This issue of marijuana usage is not going away anytime soon, obviously. And could you just elaborate, because I've had this argument made that marijuana technically does not impair the driver. Could you just elaborate a little bit on and clarify that in fact it does impair the driver?
Well, whoever said it doesn't impair it, I don't know. He must have been smoking something, because I have no clue.
It's just an argument, obviously, that it's
I'm
okay
sorry.
to do this. And
I'm sorry, it does affect. Absolutely, that's a wrong statement. That's a false statement. So
just response times, dizziness.
I don't really ever see. Well, I can't speculate what the government's going to do about changing that particular certification. I think they're always going to keep it a federal class 1, but each state will be governed of their own rules and regulations for that. But even if it does become a class 2 or a schedule 2, there's still the FMCSA needs to make sure that mandated that particular medication can't be taken and drive a commercial motor vehicle. So next slide for me. So let's talk about what's going to happen when we start getting back into the terminals, back into the companies, when the drivers come back. What I noticed in the first couple of weeks of the pandemic shelter in place, I noticed a lot of drivers that decided they're not going to drive at all during this particular time. And the ones that were driving seemed to be over inundated with positions or driving, or what do they call driving for the loads that they're taking seem to be having more and more and more. And that concerned me a lot, because I knew these guys were getting just totally exhausted and tired. But the CDC guidelines, they are a recommended, not mandatory, but recommended health and safety action in place. And I always recommend that we do follow the CDC guidelines, because if someone does have the coronavirus and is infected and has no symptoms and does affect people, the whole terminal can be shut down. So basically what they try to do, and I think everyone has heard these CDC guidelines 1,000 times, but I'll just cover them basically. Make sure they promote healthy hygiene practices. As we know with truck drivers, sometimes they come in from a road and they've been traveling for a couple of weeks, and I don't think they've taken a bath in a couple of weeks. And yes, I've had examination with those guys. They need to be a little bit more concerned about their overall health, and the safety director or their recruiter or whoever needs to make sure that these people know that these are the recommended guidelines that they need to follow. Such as hand washing, employee wearing face coverings as feasible. I know that the face masks are horrible for some people. It's what we call face mask hypoxia, where you're not getting enough oxygen. If you're an active person, you're doing a lot of things, like I'm a chiropractor, and it's very difficult to wear a mask while you're adjusting, because it's a physically active type situation. Still, the 6 feet distancing is necessary. Cleaning, disinfection. I know the terminals will have their maintenance people to be highly extra sanitation, extra cleaning, extra disinfecting in the area to prevent the outbreak of the coronavirus. Of course, social distancing. Consider modifying travel and commuting practices, promoting telework for employees who do not live in the area if feasible, and train all employees' health and safety protocols. When I do my examinations here in my office, I always wear a mask. I recommend that the drivers wear a mask, because I don't know, I see them once every year or 2 years. So that's just proper CDC guidelines protocol for me. I also have we use a hand sanitizer. We actually use a natural hand sanitizer made with Everclear, tea tree oil, lavender, and glycerin. And as I tell all my patients and drivers, I say the tea tree oil and the lavender are antiseptics to the skin, and the Everclear will actually kill 100% of all viruses and brain cells if necessary. So, you know, we like to use the natural stuff, and everyone my age always says the same thing. We used to drink that stuff back in college. So let's go to the next slide for me, please. All righty. So moving forward is the ongoing monitoring place. Develop and implement procedure to check for signs and symptoms of employees daily upon arrival as feasible. Encourage anyone who is sick is to stay home. Some of the biggest concerns we'll have is with drivers that need to support their family and have to work, which I've dealt with over the past 6 years almost all the time. It's like, I got to have a job, I got to feed the family, but if they're sick, they have a condition, they have blood pressure, diabetes, if they have a fever, whatever it may be, stay home. Simple and easy. Don't come in. And I think our first line of that is probably either the recruiters of safety to make sure that you know, these questions are asked to them. Plan for an employee gets sick, regularly communicate and monitor developments within local authorities and employees, monitor employee absences and have flexible leave policies and practices. Be ready to consult with the local health authorities if there's cases in the facility or increasing cases in the local area, and support online orientation process to minimize in-person contact. Next slide.
Yeah, Dr. Shirley, I had a quick comment on the online orientation. That's obviously taken an uptick in the last COVID period. Your determination, fit for duty, and even the normal process, whether it's a live orientation or online orientation, is totally independent to you. You make that determination, so somebody who's considering doing online orientations can get a full fit for duty determination prior to the live portion of an orientation.
Absolutely. That's the best option during this pandemic time. But then I'll also concern myself with the medical examiner who doesn't have a lot of experience in making sure that these conditions or problems or issues, not along the fit for duty, but also having to deal with, you know, fever, they've had sickness, or they've had flus, if they've had symptoms that would correlate to a coronavirus, to make sure that that's taken care of also. But it keeps the terminals and the businesses safe by do having examinations outside of the terminal itself at this particular time.
Dr. Shirley, we have a question already. I actually find this one very intriguing. It says, if my drivers make their own hand sanitizer out of alcohol, Everclear or whatever, what is it you called it a second ago, can they get busted for open container?
No, that's isopropyl alcohol.
Okay, interesting.
Not unless it's Everclear, you know, if it's, no, they're not. I mean, think about now. If you've seen these restaurants now who have the bar outside under a tent, when you go pick up your food, you can get alcohol also. So I think that particular situation has been relaxed, as you would say.
I would recommend they don't leave it in the bottle.
Absolutely. If they're going to make it, put it into a squeeze bottle or any type of bottle that you can use. You can actually have aloe vera also. There's a ton of recipes on Google. You just put in Everclear hand sanitizer, and there's thousands of them that come up. But if you have that, if you make them up front, then you're not going to have an issue with that problem with the alcohol itself.
Yeah, just don't make it going down the road out of the bottle.
Sure.
Okay, all right. Thank you.
Don't try to kill the virus in your throat with it either, please.
I did like that question, though.
It was a good question. Very, very good question.
So next slide.
All righty. So the COVID-19 concerns for drivers. My biggest thing for this was related to operation of a commercial motor vehicle with the driver's ability or alertness is so impaired or so unlikely to become impaired through fatigue, illness, or other cause as to make it unsafe for him or her to begin or continue to operate the motor vehicle. Motor carriers shall not require or allow fatigue drivers to operate a commercial motor vehicle. A driver who informs the carrier that she needs immediate rest shall be given at least 10 consecutive hours before the driver is required to return to service. And I hope the policy of safety, the safety people and risk management, HR, they understand that if a driver needs some time, they need some time. And I hope that they will follow this recommendation, because the more that a driver is on the road and extending his time decreases his immune response, which then he is more readily can be more sick and have much more conditions, flus, viruses, or other condition that can affect his blood pressure, diabetes, and such like. So next slide. I think that may be my last one. Yeah, that was my last one.
Okay.
Any questions, Mark?
Well, just a comment when we're all, the reality is we have over multi-million drivers out there with expired DOT physicals.
Right.
And it's possible some of them think that because it is expired that they can discontinue prescription medication for high blood pressure, for diabetes medication. They can eat whatever they want. They can take whatever medications they want, maybe even use a little bit of recreational marijuana, and all's good because they're in this waiver period. That's a concern. Would you agree with that?
I agree with that 100%. Not just a situation where the pandemic situation going on, but just even without the pandemic, we still had issue with drivers that when they do take their time off, they seem to lax up on everything, what they eat, the medications they take. A good exercise program is highly recommended, watching how they eat, what they eat. But it also goes down to how what they were taught growing up of how they eat is one of the biggest issues that we have.
Well, that's critical. That's critical all the time, but particularly now because of the immune system, because of that.
That's correct.
Okay.
The funny thing about the coronavirus, in my opinion, is it affects certain people who have certain immune deficiency or immune issue. And that could be a genetic type situation where if their body does not produce the immune responses to break things down, they are in much, much higher issues for any type of flu, virus, or condition that would cause to detriment their health. But most people don't know what their genetic history is. And the great thing about the new DNA test coming up, they can actually find out if their immune responses are diminished and how it will be affected by that. Where some people, within 3 to 4 weeks, unfortunately, God forbid that they die from this coronavirus. And some other people never get a symptom, or maybe just a flu-like symptom itself. So it's something that we really need to concentrate on in keeping our CDC guidelines, recommending the hand sanitizer, the washing the hands, the face mask. And I know for most people, it's an issue, it's a problem, it's affecting their activities of daily living and everything with that, but it's still a virus that kills people, and we just got to make sure that we follow the guidelines.
I think the real reason that we have, tell me if I'm right or wrong on this, but it seems to me with the research I've done, the real issue with the coronavirus is we just don't have any information, and we were trying to respond as we went along. They didn't know if it was going to be a pandemic of 1918 or they didn't know how it was going to react, how it was going to spread, et cetera. So a lot of these things they did throw a blanket on everything to try to stop it. And then they're starting to gradually peel it back and say, okay, this doesn't work, or this doesn't work, or we don't need to do this, we don't need to do that. But the original assessment was, we don't know what we're sitting on top of.
That's correct.
So
there's a lot of information and a lot of misinformation, and it changes daily, as we know. So, the, you know, the, 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 the doctor, Dr. Faucia. Faucia is the guy's name. You know,
I'll see
he deals with those particular type of situations, and he's coming off at exactly the way he should, because worst case scenarios, millions and millions of people die. And so he has to make sure that, you know, we are safe, and we have to make sure we follow these guidelines so that we don't spread it even worse. And I still think that we still have several months, if not a year, of a continuing gradual decrease in seeing more and more people itself, as we see more people coming out into the public now. We'll just have to wait and see. It's a wait and see type situation.
Well, we're following the recommendations here. We're gonna gradually open up some of our other offices and have temperature readings. Only 2 people in the break room, depending on how big your break room is. I've heard people say that if you're working in a tower, only 2 people in the elevator or 1 in the elevator, which is going to cause the cities to have a real issue trying to reopen. But in our case, it's stay 6 feet apart, do the social distancing. If you can wear face coverage, try to. It's hard to do that when you're on the telephone. You notice that none of us, but we don't have anyone else in the office with us, are wearing face covering.
Correct.
So all of these things are good recommendations. I've noticed in our own company, we put this into place while we still worked through this. We did the 6 to 10 feet apart, and the people have been very cautious. We have someone in the company that has now been deemed, germ doctor or germ general, because they were the one going around and wiping down everything. And so, she's done a tremendous job, and we kind of gave her that title as tongue in cheek. So have fun with everything you're doing, but take it serious, because it is deadly.
Hopefully she won't ask for an increase in income because of her new title.
So, but what we've done is we made safety training videos available, what y'all are going to see is an offer for a trial with our website, a trial with our training platform. We've made these videos available, and there are more that talk about how to stay safe, and what can you do and how do you do it. So we have cabin sanitation, how do you clean your cabin, general health tips, and then just general information, and so much more that you can find within our system. So next slide, please. Oh, so now we're looking for the comments. Okay. Any questions, comments, anything like that? Nope, we don't have any more questions coming in right now. Let's go to the next slide and see what we have over there. So here's what we've been looking at. The 5 leadership principles. This is part of that series. I'm going to quickly run through them. Leadership number 1, propel the psychology of the problem solver. Leadership number 2, the new effective organization and crisis management. You saw that structure on the slide, and we brought in one of the experts that would fill in one of those ovals that we had over there. And here's Dr. Shirley telling us what's happening out there, in the real world that he has to deal with day in and day out, and the trucking companies have to deal with. And then number 3, obviously, in any type of crisis, you need more agility. The leadership practice number 4 is the healthy rhythm of the organization. And if you want more information on that, go back and look at some of our slides, some of our shows, the webinars that we've done that are on infinityworkforce.com right now, that they're available. Same thing with empathy and bonding. One of the things that I really love about this type of a situation is that when you jump in that foxhole with people and you go through a crisis like this, you bond with some people. Mark and I have probably bonded more than we ever have in the last 25 years. And it's, Mark is such a great manager of trucking companies. His OR was always extremely positive. He had the, what, in the low 90s, Mark? You were always working great ORs, and is a good manager and knowing what's going on. And those are still the targets that we're looking for in this industry today. But if y'all like what we've seen so far, regardless of your role in the company, regardless, you're a problem solver. Otherwise, you wouldn't be on this. You wouldn't be looking for solutions. Invest in online orientation. It is number 1. You go out and invest in that. Start using our COVID-19 content, and email me, jay@verticalag.com, or call our 800 number. And then the E that you can't see there is basically we're willing to put together a 30-day free trial for people to try this. So we'd really like to have your participation in that. Use this. Don't just try to survive this. Try to thrive during this environment. And what are you going to do in the next 6 months as things change? My father always said there's nothing permanent but change, and gosh, was he right. We keep hearing, well, when things get back to normal, things are not going to get back to normal. You know, this is the new normal. It's going to gradually come around. It's going to gradually come back. But right now we're living in the next 6 months to 18 months, we're living in the new normal right now. That's just the way it is. I wish I could tell you otherwise, but that's what our research has told us.
That's right.
So figure out how you can be more profitable. Take advantage of our free trial offer. Mark, I know you and Dr. Shirley have some closing comments. I don't see any more questions coming in.
Well, I think we have a poll. Do we have a poll for more information? Colin? Hello? Okay. Yeah, if you would like more information on the 30-day, just click yes. That's all you got to do. If you'd like to talk to Dr. Shirley about specific information, again, he is a nationally recognized fit for duty expert in this field, and I would strongly encourage you to take advantage of the 30-day complimentary trial. And Jay, I've got to tell you this, I was driving around a little bit and I saw 3 or 4 billboard signs. Have you been hit by a truck? But I saw my first, have you been sick lately? Give me a call, attorney. And I think the online content that you've developed for your clients, think about that. You need to document the training for sanitization, for day-to-day things. These plaintiff's attorneys are not going to go away. They've already started advertising for people that aren't doing that. So I applaud you for getting ahead of that.
And there's a question. There's a question I'm going to answer here online. Okay. Since I have a driver and his medical card expired 3/28/20, up to this day has not gotten his new one because he has high blood pressure problems, and therefore we have not let him drive. That's a excellent determination. He just got his medical card approved by the doctor today, but it is going to take weeks until the DMV certifies it. Can he drive a CMV with a card that is valid but is not certified? Yes, he can. According to the emergency documentation certification, he does not have to have that particular, as long as the medical examination certificate is valid and correct, he can drive. They don't have to have it certified till June 30th. So that, yes, he can drive.
Good, excellent. There we go. Now, it just popped up the poll question. If you'd like to learn more about it, check yes. If you'd like Dr. Shirley to contact you, click on the yes. So, all right, we probably ought to leave that up for about another 30 seconds or so while people find their clickers and click. And
other than that, I'm going to certainly participate in some fresh cantaloupe from the Rio Grande Valley. I might go buy me a bottle of Everclear to put with it. I don't know after this discussion.
All right, so Dr. Shirley, thank you very much. Mark Ray, thank you very much. We appreciate y'all both, and thank you all for participating, and thank you for joining us to the group out there. Y'all have a wonderful day.
Thank you.
Thank you for the opportunity. Thank you so much.